everyone. My name is Dr. Titi, and with me here today is Chinasa Imo.
Thank you so much, Titilayo, for having me. I know that you're a very busy person as a doctor doing your research and everything, so I'm happy that you brought me to your platform today. Thank you.
Of course. So we've been hearing so much about what about rural health? Like everywhere I turn, it's what about rural health? Can you tell us about this your new project?
Thank you for the question. Yes. So just like the name of the project says, what about rural health with a question mark? It's a project that I created to raise consciousness amongst different people around rural health and rural health accessibility. So the question mark is about, this is a forgotten concept, this is a forgotten idea, this is a forgotten problem that we don't talk about all the time. So the question mark triggers that consciousness, that curiosity to begin to ask further, what is it about rural health? And I know that healthcare and healthcare accessibility is something that everyone should care about, but rural health should be something that is in conversation when we talk about global healthcare, health system strengthening, healthcare reform, health transformation, healthcare equity, whatever it is that we are talking about that provides access to healthcare to every human being as long as you are on earth, wherever you reside, should be at the center of that conversation. And I want to make sure that we situate rural healthcare in that fora where these discussions are discussed and heard.
Thank you so much. I definitely relate with this conversation because I'm a rural girl myself, and I'm sure you know that. So there's also something we really want to hear, and I know people out there also want to hear about the misconceptions you've encountered. Every new project has a struggle. So if you can just share some of those misconceptions with us, I'll be glad.
Thank you for bringing that up. So I was having a conversation with someone and he asked me and said, why should I care about rural health as an urban person? Why should that matter to me? That is already number one misconception about rural health, thinking that you as an urban dweller should not care about rural health. And let me tell you, the thing that many people forget easily until it's struck, there is always the linkage between urban and rural. This is a byway traffic where you move from urban and move inside rural and move out from rural to urban. It might not be human movement. It could be, the movement of goods and services, right? Exactly. Food insecurity. For instance, we live here in Chicago, right? Illinois. Someone who lives in a place like Carbondale, that is a very agrarian community within the Illinois state, is concerned about food production. Now imagine that there is, say, a disease outbreak and that contaminates food, and this food comes to your shelf in the town, in Costco, in Walmart, in your neighborhood store. Remember that there could be a potential possibility that because they don't have enough funding to do research, to understand that, this plant, even though they are looking very beautiful, but it's been contaminated by disease, and then me and you would pick it up in the neighborhood market to our kitchen as urban dwellers, and then we eat and become contaminated with diseases like salmonella. That's how they get to us, right? Yeah. So when we begin to think that because we don't live in rural area, it doesn't concern us, that is number one. The second one is, in my line of research as a researcher, I've come to understand that when you pay particular attention, you begin to trace genomic markers between people of different places in pockets of different places. And you can trace it to a particular environment. You can trace it to a particular community. For instance, issue around cancer and cancer disparities for Black people in the United States. There's a research that I was part of temporarily. I just did data cleaning and a little bit of data analysis for that research. And I come to see that even though most blacks in the south side of Chicago, for instance, do not directly trace their ancestral heritage to Africa, the genomic markers of the cancer that we see were very linked in that research. We call it longitudinal study. So the genomic markers were the same. Now you would say, oh, poor rural area in Nigeria, and some women are suffering from cancer over there, versus people living in Chicago or somewhere else in the US, right? What is the business there? But if you invest in research and care much about rural health, you begin to see that there are things that you understand based on research, based on investment in the health system, that would explain some of the misconception as well, but also some of the misunderstanding within healthcare advancements, that
misinformation,
the misinformation that we have not gotten to. That is number one. The second misconception is that people should invest where population is, and therefore rural health should not be a priority place, because one, it costs too much to invest in rural areas due to lack of transportation and some other impediments that we hear about, and also that there's potential that those projects might not be sustainable. But we have seen that in as much as rural areas are places for health concern, like disease outbreaks, we know it, and unending issues that rise up with healthcare in rural areas, those environments have created spaces for people to innovate. People are now innovating. How do we use things like telehealth medicine, which is the obvious one, but also how do we use portable technologies to deliver care in the absence of those well-known infrastructure that services the urban environment. And those innovations, when you scale them, you see how they transform the narrative for healthcare systems. So that is the second misconception. The third misconception about rural health is that everyone in rural environment just needs basic care. Therefore, as long as they have like basic healthcare facility, a nurse, probably a midwife, for childbirth and everything, but that is not true. Rural health people still face as much health challenge as urban health people, and which is why we see that high mortality rates happen in rural environment, because we disinvest and underinvest these areas, thinking, oh, as long as they have basic health, so we can maybe use referral pattern, which is okay if those referral big hospitals are closer to the rural areas, but that's not usually the case, where you see a big teaching hospital in a semi-rural area where rural people can go and access. So all of these things culminate to, there are a lot, but let's just settle with these three big main ones for why rural health continues to be an issue up until now.
Thank you so much, Chinasa.
Thank you.
If you've not tuned to What About Rural Health, do it now to learn more about What About Rural Health.
Thank you so much, Titilayo, for having me.